Good afternoon, everyone. I am Frank Jarosinski, Lieutenant Colonel, Maryland Wing Group 2 Commander. And this is session 15, Remobilization After COVID. Attendees, please mute your mics for the presentation and also turn off your cameras. The chat room will be used for question and answers after the session or for any technical issues that are coming up. When you use the chat room, please state your name, rank, and unit for identification purposes. I will send a post-session survey in the chat room before the session ends. I would like to introduce the presenter. He is Brigadier General Edward Phelka. He joined CAP in 1987 as a cadet in the Michigan Wing. He earned the Spots Award in 1993 and the Wilson Award in 2007. He commanded at the Squadron, Group, Wing, Colorado, and Region, Great Lakes, at the Great Lakes region. He's also a command pilot, also a mission pilot, check pilot examiner, and a cadet orientation pilot. He became the National Vice Commander in September 2017 and currently leading the National COVID-19 Remobilization Team. Sir, you may begin your presentation.
Hey, thanks very much for the introduction, much appreciated, and I'm very glad to be joining you for the virtual Maryland Wing Conference. I'd like to give you a little bit of a look at remobilization and kind of a peek behind the curtain, kind of a behind the scenes look at what we do and how we do it with respect to remobilizing back into something closer to normal operations in Civil Air Patrol. So back on March 14th, I'm sure you'll recall, General Smith issued a stop movement order for CAP that mirrored the Department of Defense order that was issued around the same time. CAP units were directed to stop holding in-person meetings, and member travel was limited to mission essential travel only. A Coronavirus Information Center was established soon thereafter, where all relevant communications are consolidated. And you can visit that page today. When you pull up gocivilairpatrol.com, there's a link right at the top for the Coronavirus Information Center. Soon after the stop movement order, General Smith appointed me to lead a team of health services volunteers as well as operations employees to determine how best to remobilize Civil Air Patrol once the public health conditions allow. So on this slide, you can see the members of that team. This is me over here, and here you've got John Damaris. You all know and love him, Moose. He's the CAP's Director of Operations, and his deputy is Ron Olenek. On the volunteer side, we have our Program Manager for Health Services. This is Lieutenant Colonel Tom Janisko, and you're thinking, what the heck uniform is that? Is he in the Navy? No, he's actually a commissioned officer in the United States Public Health Service. He works in Washington, D.C., and he happens to also be on the White House Coronavirus Task Force. So we've got a real insider with tremendous amount of expertise in this particular public health crisis. Over here, we've got a medical doctor, Dr. Stephen Layton. He's the Deputy Program Manager for Health Services. And Ed Boss is the Inspector General for Oregon Wing. He's also a health services person. So we've got a considerable amount of expertise on the health services side, as well as a lot of experience from operations and CAP employees. This team devised checklists and templates for wings to follow, preparing to resume normal operations. And all of these resources can be found on the Remobilization webpage, and that's the address right there, gocivilairpatrol.com/COVID-19-remobilization. So I'd encourage you to visit that page if you'd like more information on remobilization. So how does remobilization work exactly? Well, the CAP remobilization plan mirrors the White House three-phase plan for reopening America. So as CAP moves from a completely closed and mission essential travel only stance toward normal operations, wings progress through three phases of gradually decreasing restrictions and gradually increasing size of permitted gatherings. So of course, phase 0, which is completely locked down, is not one of those three phases. Phase 1, phase 2, and phase 3 is what I'm talking about. And again, all this information is available on the Remobilization website. Some of this information has been modified since it was first published. We've learned a lot more about the virus and its impact over the last 7 months. We've also learned how well CAP members comply with guidelines and restrictions, giving us added confidence in gradually moving certain activities into earlier phases. One example, of course, is cadet orientation flights. Those were originally published as being permitted once a wing reached phase 2 of operations. They've since been moved to phase 1. Wing commanders who remain in phase 0, that's basically mission essential travel only, those wing commanders can issue a memo that permits certain flight activities to maintain mission readiness, even in phase 0. This is all because our members do an excellent job of taking risk mitigation strategies very seriously. So this is a snapshot of the current national remobilization picture, and I updated this slide this morning, and it's already out of date because we had another wing. My home state of Michigan, in fact, has just moved backward into phase 1. So as of earlier this morning, all wings have at least submitted a phase 1 remobilization plan. So we have at least one plan on file for every one of our 52 wings. And as of this morning, we had 22 wings approved for phase 2 operations. 18 were approved for phase 1 operations, and 12 are either on hold for phase 1 based on public health data or are working with the COVID-19 plans team on revising their submission. Of the 7 active overseas units, Osan, which is in Korea, Ramstein in Germany, and Chevers in Belgium are all in phase 0. Okinawa and Yokota, both in Japan, and Spangdahlem in Germany are in phase 1, and Mildenhall in England is in phase 2. These overseas squadron moves are made in coordination with the guidance from the military installations where they meet. We don't have nearly as good information as those military installations do on local conditions, so we've permitted those overseas squadrons to move together with the base or the installation where they meet. It's worked out very well so far. With the recent surge in COVID-19 across much of the country, several wings have had to pull back to a more restrictive phase during the last 6 weeks or so. These wings include all of Rocky Mountain region, most of North Central region, and much of Great Lakes region. And now, because Michigan is moving backward, it's almost all of Great Lakes region. California, Iowa, Nebraska, and Hawaii have been approved to remobilize by group or subordinate unit. So California is moving by group, Hawaii is moving by island group, and then Iowa and Missouri, not Nebraska, Iowa and Missouri are remobilizing by squadron. This is more complicated, and we're following these things very closely. So far, it's going really well. But what it means is those wings have to do basically over-communicate what's going on. They dive really deep into county-level data, and they even look at, of the people in this county, how many are homeschool, how many are attending school in person. So those wings are going really, really deep dive into the data. So far, as I said, it's all going well. Each of these 4 wings have phase 2 plans approved, and they have subordinate units in either phase 1 or phase 2, or in the case of Iowa, the entire wing has had to move backward into phase 0 because of the conditions in the state of Iowa. COVID-19 plans team analyzes data from multiple sources to determine a wing's readiness to remobilize. Our primary sources include covidexitstrategy.org, which is this website over here, the Johns Hopkins University Coronavirus Information Resource Center site, covidactnow.org, and each state's public health or COVID-19 website. FEMA provides a senior leader briefing, which gives additional detail on critical outbreaks, and additional sites provide even more information. So as remobilization plans come in, data is analyzed as close to real time as possible. Wings might have access to additional information, which of course they're welcome to cite for our team to examine as well. Minnesota Wing, for example, pointed to the Mayo Clinic's coronavirus page for more information on Minnesota-specific numbers. Once a plan is submitted, feedback is given to the wings on their plans, and those plans are eventually approved based on standardized information as to what's allowed in each plan. FEMA provides daily information on COVID-19, as I said, and it measures trends in all 50 states, plus numerous U.S. territories, such as Washington, D.C., Puerto Rico, the Mariana Islands, Guam, etc. As of yesterday, there was an upward trajectory in COVID-19 in case counts in 52 states and territories. Only 1 jurisdiction was in a plateau status, and only 2 showed downward trajectory. So COVID-19 is on the rise almost everywhere that calls U.S. soil. Nationwide, there have been at least 10.6 million COVID-19 cases, which increased by over 153,000 just in the last 24 hours. Globally, there have been over 53.5 million COVID-19 cases. That's a staggering number. In the United States alone, there have been 160 million COVID-19 tests administered. This slide shows examples of the COVID Act Now website. The map changes every day as data gets updated. The two examples are taken at about 6 weeks intervals, the most recent being this morning, November 14th. States will change color when a single metric crosses a given threshold. The color alone, of course, is not our only driver for action. Rather, we dive deeper into the statistics and we look at trends. I'm happy to report that Puerto Rico was recently added to this site after our COVID-19 plans team met with the developers of covidactnow.org and gave them feedback. So we remain in touch with the leaders of this site, and we regularly collaborate with them on data presentation and use. The covidactnow.org is actually really excited about partnering with Civil Air Patrol to the point where they plan a press release to talk about CAP and how we use their data. It's a great partnership. The New York Times published an article on COVID-19 pandemic back in mid-October, just as this current third wave was beginning to be felt. And it included some really interesting graphics, one of which I copied and pasted here on this slide for you. And it shows 3 snapshots in time, April, July, and mid-October. You can clearly see the hotspots where the population was severely impacted. New York City and parts of the Northeast were hard hit at the very beginning, up in here. After the 4th of July holiday, much of the Southeast was seriously in bad shape, with infections running rampant. The current trend has moved north and west, impacting the Mississippi River Valley and the Great Plains states very severely. Many states in the upper Midwest are sparsely populated, so the per capita infection will show as very high, even with relatively low number of actual COVID-19 cases. We'll talk about more per capita and what that means with the spread of COVID-19 in just a minute. This graph from the CDC's website clearly shows the first wave of the virus back in March, the second wave of the virus after the 4th of July holiday, and the current third wave that began in earnest as most students headed back to school for the fall semester. So, metrics. There are a number of metrics available to us on the different websites that we use. I'll show you an example of 3 of the main ones that we watch. This graph represents numbers from the state of Maryland, so I pulled these for the Maryland Wing Conference. First, the daily new case count per 100,000 population. This allows us to express the spread of the disease normalized for population. By converting to a per unit of population number, each state's daily new case count can then be compared using the same scale. It's like comparing apples to apples. I'll use California and North Dakota to illustrate an example. Take a look at this. This slide shows the raw number of cases in California with a blue line and in North Dakota with an orange line. And based on this, you can see that California has had far more cases on a daily basis. In fact, the 7-day moving average for daily new cases in California is 6,900 as of this morning. That's about 6,900 new cases per day on average. Back in July, the state peaked at about 10,000 new cases a day. That's more than many countries have. The 7-day moving average for daily new cases in North Dakota, on the other hand, is this, as of this morning, 1,334. Again, California, 6,900 a day. North Dakota, about 1,334. That number is currently close to its peak, and it's been rising since August. Based on this information, you might think that California is far worse off than North Dakota. But California's population is 39.5 million. North Dakota has 762,000 people. It takes far fewer cases in North Dakota to move the needle on percentage of the population. So when we talk about the daily new case count, we always normalize for population, new cases per 100,000 population. Put another way, the daily new case count in California is 17.5 per 100,000 population. The daily new case count in North Dakota is 175 per 100,000 population, exactly 10 times higher than California. So if you gathered a random sample of 100,000 Californians, between 17 and 18 of them would have COVID-19. In the same sample size of North Dakotans, 175 of them would have COVID-19. The disease has penetrated far deeper into the population of North Dakota, which is more dangerous. It makes coming into contact with an infected person far more likely. Clearly, sparsely populated areas are strongly impacted by only a few cases of COVID-19, since this reflects a much higher percentage of the population. So for phase 3, everybody wants to get to phase 3. That's where you're allowed to have overnight activities, wing conferences in person, encampments, etc. For phase 3, we're looking for a 4-week downward trend in this metric, the daily new case count metric. Lieutenant Colonel Janisko has stated that a 4-week trend is far less likely to reverse, meaning we have a higher confidence that the new case count will continue to recede. Here's a comparison drawn from the Johns Hopkins University Coronavirus Resource Center. The map on the left shows the highest raw number of cases that are happening. The Southwest, El Paso, Texas, Chicago, Detroit clearly are hotspots for raw numbers of new cases. But the map on the right normalizes for population, showing that the areas covered by North Central region and Rocky Mountain region are experiencing dramatic increases in the percentage of the population impacted by COVID-19. And that's why these wings are the ones that are being moved backward into phase 1 and in some cases back to phase 0. This is a similar set of maps looking at the cumulative confirmed cases across the country. That's since the start of the pandemic. And the cumulative confirmed cases by population is on the right. So clearly a high raw number of cases are happening in large urban centers, no surprise. Los Angeles, Denver, Dallas, Houston, Chicago, Detroit, New York, Washington, D.C., Atlanta, and Miami. Those are all large numbers of raw number cases. But sparsely populated areas from Idaho to the Dakotas to Wisconsin are seeing large segments of the population impacted by COVID-19. So the next metric I'll talk about is the infection rate. Infection rate refers to the number of individuals a person with COVID-19 will likely infect with the disease. A lower number, of course, is best. A number below 1.0 means the disease is shrinking in a specific state. A number above 1.0 means the disease is spreading. The higher the number, the faster it's likely to be spreading. So for phase 3, we're looking for an infection rate to be 0.9 or lower. So as you can see in this chart, Maryland was there after the first wave of the virus receded. When the second wave hit in July, the infection rate crept up, and it's doing the same thing now that we're in the third wave. So again, for phase 3, we're looking for an infection rate 0.9 or lower. Back in March, when COVID-19 was first impacting the United States, only symptomatic individuals were being tested for the virus. That's when we saw extremely high numbers of those tests coming back as positive. As testing became more widely available, those rates began to drop. And fortunately, in most cases, they've stayed low. Some areas of the country are still seeing high positive test rates, though. Nebraska is 38.5% positive, Montana 26.6%, Iowa 24.1%, Idaho, South Dakota, and Kansas are all seeing much higher than 22% positive test rates. So it is posited by health experts that widely available testing will result in a lower positivity rate. The more widely available the testing, the better our chances of identifying and isolating cases of COVID-19 early. Maryland's positive test rate is a very manageable 5.6%. What we're seeing with this current third wave is a rise in positive test rates, even with widespread testing. This tells us that COVID-19 is penetrating deeper into communities, but fortunately we're catching it with recognizing with positive tests. For phase 3, we want to see a positive test rate below 10%, and lower, of course, is better. So with those 3 main metrics in mind, let's take a look at the situation in each wing within Mid-Atlantic region. We'll start with Delaware. Delaware is clearly trending in the wrong direction. The daily new case count metric crossed the 25 threshold on Friday, turning the state red on one of our main sites, covidactnow.org. You can see in this chart here, this one shows the number of daily new cases, and it's rising very steeply. And together on the bottom, this is the test positivity rate. Over here, these are the metrics that we see on covidactnow.org, and this is covidexitstrategy.org up here. You can see a rise in positive test rate, though the 2 sites don't agree on exactly what number that is. The 4.9% on COVID Act Now is a November 10th number, while covidexitstrategy.org, the number is more recent. Delaware's own COVID-19 dashboard displays this metric in two different ways, adding some confusion to the mix. The preferred metric on their site shows a 7.3 positivity rate. So with the current trends in Delaware, a move to phase 1 may need to happen in the coming weeks. Not something we like to do, but our prime directives are keeping our members safe while maintaining mission readiness. So the number is clearly rising regardless of the source that you're examining when we're talking about positive test rate. The trend is the important indicator to the COVID-19 plans team, and this also explains why we look at multiple sources in order to make a well-informed, data-informed decision. The daily new case count in West Virginia is rapidly on the rise. Positive test rate is also beginning to follow suit. The steeper this graph, obviously the more rapidly the number of daily new cases is rising. The first and second waves of COVID-19 did not impact West Virginia very heavily, but the third wave is starting to be strongly felt. West Virginia was one of the wings that helped the COVID-19 plans team beta test our templates and checklists at the very beginning of the remobilization effort. They were chosen in part because the disease had not penetrated the state very much, and we believed they would be one of the first wings out of the gate for remobilizing after the March lockdown, and West Virginia has been very helpful to our team. If the current trend of rapidly rising daily new cases continues, West Virginia may need to prepare for a move backward to phase 1 in the coming weeks. So we'll be watching it very closely. North Carolina's situation is less severe. While cases are on the rise, they're rising less steeply. The positive test rate is relatively flat, which is good. The infection rate is also close to 1.0, showing that the disease is spreading, but it's spreading slowly. Like North Carolina, South Carolina is showing slower disease growth at the present time, along with a relatively flat positive test rate. And you can see that the northwestern part of the state, those counties are in a little bit more trouble. If you click on the county in covidactnow.org, you get county-specific statistics, and you can see why each individual county has turned red based on which one of these metrics has exceeded the critical threshold. covidactnow.org doesn't break out Washington, D.C. specifically, but covidexitstrategy.org does. So the district has very strict travel restrictions. The positive test rate in D.C. is very low, which is great. Cases still are on the rise, though. From the very beginning of remobilization, the team recognized the unique nature of the National Capital area. There are NatCap squadrons that meet in the state of Maryland and in the state of Virginia. Members live in Virginia, Maryland, and the district, and might be member of any one of those three wings. So we decided early on that these three wings should always be in the same phase of remobilization, just to avoid confusion. The teams working under these three wing commanders have done an excellent job of coordinating these submissions of their respective plans, and all three wings are presently in phase 2. Cases are on the rise in Virginia as well, but look at the difference between southwestern Virginia and the eastern half of the state. In making a decision on remobilization, the team will look at where the squadrons are in the state. There are no squadrons in the red areas of southwestern Virginia, and very few members live in those western red counties. The team will tolerate higher metrics in this state given this appropriate context, and will do the same thing in any other state. So if you see that the specific counties are bright red, southwestern Virginia looks really, really bad, but then you pull up the Civil Air Patrol website, gocivilairpatrol.com, and you click join and you click squadrons and you look at where the squadrons are, you can see that there's absolutely no active squadrons down in that part of the state. So I'm not as worried. And this part of the state where the counties are yellow means those metrics are in much better shape. I'm more comfortable, even if the state of Virginia were to turn red on covidactnow.org, putting it in the appropriate context, I'm still comfortable with Virginia being in phase 2. Finally, here's a look at Maryland wing. You can clearly see from the graph that the daily number of new cases has begun an exponential rise in late October, early November. This is an alarming trend which will cause the state to turn red on covidactnow.org in the next day or two. Test positivity, though, is a manageable 5.6%, as we said earlier, but it's also rising. The history of cases graph, this one here, clearly shows that Maryland followed the national trend several weeks after each wave. The northeastern United States was heavily impacted in March and April by the first wave. Maryland shows the first wave in May. The second wave hit the southeastern United States in July, right after the 4th of July holiday. Maryland shows the second wave in late July and early August. The third wave began severely impacting the upper Midwest and Mississippi Valley in early October. Maryland is showing the same wave hitting in late October and early November right now. The Maryland Department of Health has a web page with information on the state's cases and various relevant statistics, including how many cases are in each county, and that's right here on this little map. Many of the metrics we discussed earlier are presented in a slightly different way, so you can dive into the details if you like by visiting coronavirus.maryland.gov. Johns Hopkins University provides an excellent site with a wealth of data presented in many different ways, including maps, graphs, charts, and even videos. They call it data in motion. It's pretty cool. It's a 1-minute video that they produce every single day, so go check it out. If you'd like, you can use the big map on the homepage and drill down to county-specific data. This slide shows specifics on Baltimore, Maryland. Information is provided here on population breakdown, hospital availability, number of new cases over the last 2 weeks, overall cases, number of deaths associated with COVID-19, and much, much more. So I'd encourage you to seek information on your hometown, your home county, just to see how things are where you live. On the Johns Hopkins site, under the Critical Trends tab up on the top, you can find this chart. It's a quick at-a-glance look at the whole country with each state's daily new case count per 100,000 people. Same metric, move the decimal. It's the same metric we described earlier on COVID Act Now. The background color on this graph shows whether the state is trending poorly or trending better. And this is the 7-day moving average, I believe, on this chart, drives the color. This first snapshot is from the middle of September. You can see that Massachusetts was seeing a strong upward trend based on the dark red color in the background, but many states were trending favorably. This again was September 14th. Let's fast forward. Second snapshot taken a week later, just 1 week later, demonstrates which states had the largest surges relative to population density. That is, highest percentage increase in the daily new case count in the last few days. Our team, the COVID-19 plans team, analyzes these surges and tries to determine whether they're a threat to remobilization. For example, if hundreds of cases are reported from a prison, this would likely have a lower impact on CAP compared to a series of school districts reporting new cases. So this was just 1 week after that previous one. We had September 14th, September 21st. Here's a third snapshot taken October 23rd. At this point in time, the states in the upper Midwest with dark red backgrounds were moving backward into more restrictive phases. Illinois, North Dakota, South Dakota, Idaho, Wyoming, even Rhode Island moved to more restrictive phases around this time. And here's a final snapshot that I took this morning. Iowa was moved to phase 0. Minnesota and Indiana were backed up to phase 1. Only Georgia is trending favorably on this map. Hawaii, with very strict travel restrictions, including between Hawaiian Islands, has successfully isolated itself from COVID-19. Speaking of travel restrictions, COVID-19 plans team has been asked to assist in making decisions on whether to hold certain meetings in person, gatherings such as Board of Governors meetings, the CSAG meeting, and Command Council meetings. In researching COVID-19's impact to travel across the United States, we've learned that each state approaches restrictions differently. As many as 17 different states have quarantine requirements. If you arrive in one of these states colored red from a place designated as high risk, and each state has a different definition of what that is, you may be required to quarantine for 14 days prior to being free to move about that state. Again, each state is different. I mentioned Hawaii in the last slide. Hawaii will allow you to present a negative COVID-19 test result from a test taken within 70 to 72 hours of your arrival. Other states will simply tell you to just quarantine. Our National Commander, General Smith, lives in New Mexico, which has one of the strictest travel requirements in the country. Essentially, everyone arriving in New Mexico from out of state, unless you're coming from Vermont, must quarantine for 14 days, no exceptions. And there are some exceptions for essential travel, like if you're an airline pilot or something. Producing a negative COVID-19 test results is no longer sufficient to avoid quarantine in New Mexico. So for this reason, General Smith will likely not be traveling for a while unless it's absolutely necessary. In the case of Maryland, as of July 29th, travel advisory is in place, encouraging Maryland residents not to travel to states with test positivity rates exceeding 10%. Maryland residents who have traveled to Alabama, Arizona, Florida, Georgia, Idaho, Louisiana, Nebraska, South Carolina, and Texas are encouraged to get a COVID-19 test. So again, each state's travel restrictions are different. This map is found on a website driven by Kayak, the travel site. In the case of Washington, D.C., as of July 27th, non-essential out-of-state travelers entering D.C. from a series of states are required to self-quarantine for 14 days upon arrival. Fortunately for you guys, residents of Maryland and Virginia are exempt from these requirements. This exemption, is further evidence why the COVID-19 plans team is linking the Maryland, Virginia, and NatCap remobilization phases together. Finally, Lieutenant Colonel Tom Janisco, our Program Manager for Health Services, created a slide deck a couple of weeks ago, which is now posted on our remobilization website, and it provides additional guidance and tools for wings to use in order to protect our membership from this horrible public health threat. This slide is lifted from that presentation, and it's designed to demonstrate how the COVID-19 plans team draws upon guidance from the CDC when creating recommendations from the field to keep members safe. We've had suggestions to examine other kinds of guidance, but our remobilization team with our health services experts and directions from the national commander say that we will follow federal guidance. Remobilization will continue to be conducted in a methodical, careful, and judicious manner with the health and wellness of our members as primary drivers. Our phased approach is designed to protect member health while maintaining mission readiness in all respects. Working together and demonstrating patience and respect, I have full confidence that we will make it through these challenges and be stronger because of our ability to work together. Unit commanders have reported approximately 170 CAP members who have contracted COVID-19. Fortunately, none of those infections were because of a CAP event, at least as far as we know. This demonstrates that for the last 7+ months, our efforts to gradually, methodically, deliberately, and carefully remobilize our force has been done safely, and it has been done well. For this trend to continue, we need all of you, please, to help. Please comply with all of the guidelines associated with the national and wing level remobilization plans. It's very, very important. So at this point, those are the slides I have for you. That's kind of a behind the scenes look at remobilization, how we go about it, what metrics we use, and how we move wings forward and sometimes backward. Gave you a look at Mid-Atlantic region and a little bit of a deeper dive into Maryland and even one of the biggest cities on the East Coast, Baltimore. So if you have any questions, I would be more than happy to answer those for you. Feel free to put them in the chat or turn your camera on and go ahead and ask me a question. Be happy to help.
General, there is nothing in the chat room, so it's open.
Well, if your camera is off, go ahead and turn it on. I'd love to see who my audience is today. That means you have to actually get out of bed, maybe put your uniform back on. I'd love to see who we're meeting with today. That's one of the things I really miss during this this period of remobilization and being in phases 1 and 2, not being able to get out and visit with members of the wing. I really enjoy that aspect of being the vice commander. I had a great time when I came to the Maryland Wing Conference. I believe it was 2 years ago. I really enjoyed that. It was a great conference, wonderful people, and I desperately miss that. So I'm looking forward to a time where I can approve phase 3 for all these wings so we can get back together, meet in person, enjoy the camaraderie that is a part of Civil Air Patrol membership. Really looking forward to that. Well, Colonel Strong, thanks for turning your camera on. I think you're the one person that decided to do that. Do I expect we'll have to suspend cadet orientation rides because of changing situations? Cadet orientation rides are realistically a relatively low risk activity because it's very few people getting together. That's one thing. The second thing is we have protocols in place that are designed to protect our members when doing orientation rides, and they include mandatory mask wear, as well as sanitizing surfaces inside the aircraft. So we've taken extra steps to ensure that orientation flying is safe. We're also asking members to self-evaluate whether they find themselves in what the CDC calls a high-risk category. That might include age of the member, that might include their underlying health conditions. So a lot of our pilots are older. Some of them might have other health conditions that they feel they would be at higher risk. Those folks we ask to continue to stay at home, and we'd like lower risk folks or people who identify themselves as being in lower risk categories to be the ones that participate in cadet orientation flights. And we're still going to want to do the temperature checks and indicate to cadets if you have any symptoms whatsoever of COVID-19, whether it's a fever or a cough or difficulty breathing, everything that's listed on the CDC site, that you simply would not participate in the event. So we're going to continue cadet orientation flying in phase 1 because we've demonstrated so far that it is safe to do so. 2 days post-op and you're doing a conference. My goodness. Well, thank you for participating. I completely understand staying off camera, but really glad you're able to be as part of this conference. The silver lining, if you will, for coronavirus is these virtual conferences have allowed a tremendous number of people to participate who might not otherwise have that opportunity. I'll give you an example. Back in August, when we had our national conference, a typically well-attended national conference would have between 600 and 800 people in attendance. Do you know how many people attended our national virtual conference? We had over 10,000 people participate. So doing these things virtually allows folks to participate. They don't have to travel. It's far less expensive. And if you're 2 days post-op, you can still tune in while you're convalescing and recovering from surgery. So I'm glad you're here.
General Wes LaPre, I'm one of your newer wing commanders.
Welcome aboard.
Since taking office in the 21st or so of March, I'm sitting in an office that is gorgeous, but I've only sat in like 5 times in that whole period,
Right.
Because I've been staying home and doing what we think is the right thing. You're probably going to see some conversation between us and NatCap and Virginia, as you've already mentioned. John Henderson is the team lead for our COVID response effort, and he is our health officer. We just put out an email to our members in the last day or two. The governor has pushed us to 25 people meetings.
Okay.
And other jurisdictions have taken us to like 10, which puts us a strain on activities.
Sure.
But I think what I tried to convey during the Wing Commanders College earlier this week to the members who have been in phase 0 or phase 1 forever, it seems to them, and really don't see how to do activities. I've mentioned how we've been doing them here, not trying to gloat, because I realize that the numbers are going the way they are, and it's not going to be too long, as you said, before we get into the red in Maryland.
Right.
But the theme of the conference that I've chosen to pick is the year of the squadron, because that's about the only level we're going to be able to do any activities. We've found great success in doing single day activities, whether it was an air show at Ocean City or a SARX at a Boy Scout camp in north of Baltimore, or the Warrior Challenge that was able to be done for 3 squadrons worth of people at a place called Gunpowder, 2 emergency service academies in totally different locations, all done in a single day, so that we don't spend the overnights that potentially would increase the risk for us.
Right.
So I'm hoping that we can continue to serve the squadrons, because the wing is certainly not going to be able to conduct a major activity like a SARX, an encampment. And so we're pushing it to the squadrons and groups to do that activity, because that's the only level that you can operate in this environment.
Sure.
Are the others wings that you're aware of embracing the one-day activities and refocusing on the squadrons as the
Yeah, your video froze up on me for just a minute, but I think I know where your question is going. The answer is yes. We've seen a lot of very creative solutions to what was traditionally larger activities. But let me go back for a minute, though. You mentioned that the governor was restricting sizes of gatherings, and in some cases, counties were further restricting that. Something I didn't mention in my talk about remobilization is if there are state mandates that differ from CAP mandates, we go with whatever the more strict one is. So if you're in phase 2 for Civil Air Patrol, which allows for 50 people to gather, but the state says 25 is the limit, you go with 25. So let us know at the remobilization team. Just send us an email that says, hey, here's a new state restriction. We need to modify our plan. Just so we have that information, please send that to us in a quick email so we know what that is. And then again, the remobilization effort is designed specifically to empower wing commanders like you to make little changes like that and to keep us informed and to make movements, but definitely keep us informed when that sort of thing happens. I'll give you an example of what happened in Great Lakes region. They had plans for a weekend-long major region-level exercise where they traditionally would fly in a dozen airplanes from 6 different wings. Lots of people would gather for in-person briefings. They would be given their assignments, and they would do ground team, and they would do air sorties, etc. And then they called me and they said, COVID-19, what should we do? I said, well, you can't do it the way you traditionally have. I don't want you to bring people from Wisconsin, which is phase 0, down to Indiana, which is phase 2. That's just introducing potential COVID-19 into a place where it doesn't exist, or it was less prevalent at the time. So the compromise was a virtual command post, so everyone could participate from their own home or from location remote from a central place. Air crews and ground teams were dispatched from their home airports to stay in their home wings. They did their sorties and they came back and they did their deliverable online. So the SAREX took place. It was very successful, but there was no communal gathering of everybody to be a super spreader event. It was very successful. So, your example of using squadron level and group level planners to do those activities is terrific. Something else you can introduce is a hybrid option. So if a group is going to do a cadet leadership school and they can have up to 25 attendees, let's broadcast it online and have 100 cadets additionally join online. One example of that being done really well was a combined region cadet leadership school between Southeast region and Mid-Atlantic region. I'm sure you had some cadets that participated in that. That was a way to utilize this virtual environment to reach a lot more cadets than otherwise would have been able to participate. So that was a huge success story. I hope that answers your question.
That's exactly, I think, where we're headed, because the smaller the group is the only way we can get the activity done in any way. And a virtual component of instruction followed by a solid day worth of activity at a confidence course, back to a virtual classroom environment will let us string together things that even if we work it out in our group structures, we'll cover the entire state, and it won't require some squadrons that have to travel 3 hours. For us, that's a long distance. For out west, it's trivial. But limiting the travel to group areas of our responsibility lets us get, like you're saying, the most folks involved for the level of attendance that is allowed by state and local requirements, and still get the activity done, avoiding the overnights, doing the solid day, and stringing together that activity. I talked with Kurt LaFond, and he's willing to listen to a plan that lets us do that for a couple of weekends, and sort of like the old Type B encampment, perhaps get the right number of stuff done, the only exception being the overnights.
I see there's a question in the chat about summer activities, and it's a perfect, what you just said there is kind of a perfect segue into answering that question. I spoke with Mr. LaFond about 3 weeks ago, specifically about winter encampments, because there were a lot of wings that were still anticipating holding an encampment between Christmas and New Year's. Kansas, Texas, Florida, Connecticut, those wings were looking at winter encampments. And I could tell, even 6 weeks ago that the trajectory of COVID-19 was not going to be allowing us to have any wings really in phase 3. And for an encampment, you need to be in phase 3. So the question in the chat is, let's see here, operations plans for activities and summer encampments, NCSAs, etc. Do I expect the normal application process will still be the same with restricted guidance, or will it be adjusted? I would guess that for the most part, the application process for future activities will be the same. At least it'll be very, very similar. I'm not sure what a vaccine is going to bring for us. I've heard some folks ask the question, will you be required to demonstrate that you've been vaccinated for COVID-19 before you come to such and such activity? That's really a question for our general counsel to answer. So I don't have the answer to that question yet. But as far as how next summer is going to look, I also, in speaking with Mr. LaFond, I said, Kurt, let's plan for summer encampments and national special activities to happen, best case scenario. But if they can't, because of COVID-19 is still with us, let's think about ways that we can be creative and still meet the training intent of encampment or the training intent of some of these National Cadet special activities. Obviously, you can't do a flight academy in person. You can't fly an airplane virtually. You can do flight simulator, but it's not the same. So I think some activities will be the same. Some activities may very well be different, and others may need to be canceled. It's all going to depend on the trajectory of COVID-19. I really hope that the introduction of a vaccine or 2 different vaccines could potentially squash the spread of the virus. And if everybody in the country does like the CAP members do, which is follow the rules, wear a mask, wash your hands, socially distance, all those things, if the citizens of the country would follow the lead of the Civil Air Patrol members who are doing a great job of that, maybe we could also squash COVID-19. Do I see us moving into the support of COVID activities as we did this last uptick? That's different in every state. I'm privileged to be on the distribution list for the daily situation report, and we've been getting about 220 of those. We've been doing this for quite a long time. Every state approaches this differently, and the vast majority of COVID-19 missions we get come from the individual states. New Hampshire is extremely active. They're taking aerial photos for the state almost every single day. Arizona, super active with the Red Cross doing blood drives out there. North Carolina has been active driving all over the state. Kansas has been doing driving blood all across the state. But the answer to that question really depends on this individual state's relationship with Civil Air Patrol. Again, a silver lining from COVID-19 is we have been able to improve relationships with a lot of different states across the country, where the states realize what an incredible asset we are. We're very cost effective, we're very professional, we're very responsive. So I'm hopeful that if states have needs, they'll think of us. I was talking with the Southwest Region Commander just the other day, and he used a great example of CAP wasn't even in the room. And the 2 folks were talking, I think one of them was the adjutant general, and they were talking with emergency managers from the state. They were talking about how to accomplish a specific task, and Civil Air Patrol came up. It's like, I think CAP could probably do that for us. So the more we demonstrate that we are responsive, that we are professional, that we take risk mitigation seriously, and we deliver on the promises that we make, we're going to keep getting called. So continue to remain professional, stay mission ready. You've got to stay disease-free in order to be mission ready. Another example I give is a senior squadron really wants to get together and have coffee and do some hangar flying and maybe talk aviation safety. They get together, 12 pilots come together for a meeting. One of them was exposed to COVID-19. Now all 12 of them are quarantined for 14 days. That's when your ELT goes off. None of them can respond because they're quarantined. So that's why we're asking everybody to take these risk mitigation measures very seriously, keep the number of people down at the gathering if you possibly can, and anything that can be done virtually today should be done virtually today. And then get your Form 5 and your Form 91 flight check done. Maintain mission readiness by doing proficiency flying. It's okay to go out and train more aircrew members. We need more mission pilots, mission observers, and mission scanners. We need more aerial photographers. It's okay to do that kind of training in this environment. That's encouraged. Just follow the risk mitigation protocols. Wear a mask, sanitize those surfaces, maintain that physical distancing when you're on the ground. It's really hard to do in the cockpit when someone's right next to your shoulder, but do your best, wear your mask, be disciplined about it so that we can all respond when the time comes, whether it's a COVID-19 mission search and rescue, disaster relief, whatever the case may be. Wonder if anybody else has additional questions. We're right at that time frame there, 3:50. So I'd be happy to take any more questions. I know it's the last one, but this is the designated end time for our session. So I'm here as long as you need me.
General Phelka.
Yes.
This is Connie Moody, West Virginia Wing
Hi,
Commander. Thank you for recognizing West Virginia Wing, good and bad.
Well,
And,
I think of it as good.
Yes, we are doing great. I would like to inform you that we are in the red in several of our counties. And what I have directed the squadron commanders to do is to go virtual. No in-person meetings anytime that your county is in red.
Okay,
So
and
we're
that's
trying
the
to
kind of thing.
control. Yes.
Yeah, that's the kind of thing that, again, wing commanders are empowered to do that. I appreciate you letting me know. So, you know, the meetings are going to be virtual. I totally respect that. Protecting our members' health is a prime directive. Maintaining mission readiness is right up there as well. Things like spots testing can still be done. Even if you designate some squadron to be in phase 0, spots testing can be done so that we don't hold cadets back. I know your wing is technically approved for phase 2. If you'd like to roll back to a more restrictive phase officially, let me know. But you know, you and I can talk offline or talk via email about what specific directives you have for West Virginia Wing. But thank you for letting me know. And your wing members are really doing a great job ever since the very beginning, where you guys helped us out with the beta testing of all these checklists and templates. You've been your members have been a go-to resource, and we appreciate it very much.
Thank you, sir.
All right, so for those of you who need conference credit, be sure to complete that survey, that post session survey. I see that in the chat as well. Captain Bell mentioned that. Thanks for letting me be with you. It's really, I always enjoy this opportunity. I really wish we could be doing it in person, but hopefully next time we have a Maryland Wing conference, I can be there and I can shake everybody's hand, and, you know, we can be back and enjoying camaraderie again soon.
Thanks very much.
My pleasure.
Thank you, sir. Stay safe.
Thanks for joining me. Is there a link to the survey? Captain Bell, I imagine you're going to want to post that link.